Welcome. This presentation is titled A Class for Caregivers, Planning for a HCT Patient to Go Home, and is presented by a City of Hope certified oncology nurse and clinical social worker. This presentation will go over basic guidelines and information to care for the transplant patient after they are discharged from the hospital to home. We cover many resources to support caregivers. Please keep in mind that every transplant patient's recovery is unique to them. Questions about exceptions to these guidelines are best answered by the patient's transplant doctor and care team. We also want to thank you for watching this class. Your role as transplant caregiver is essential to your loved one's recovery and is valued by our whole City of Hope team. Really, our class goals are to help you in your role as a caregiver, to learn about your own self-care needs, to know about the tools and resources that can help you, and be prepared to care for the patient at home. There are basically two transplant types here at City of Hope. They are the allogeneic, or allo for short, and autologous, or auto for short. Allogeneic, or allo for short, these are patients that receive their transplant from related or unrelated donor cells. They are matched. Their recovery time is 100 days from the day of transplant. The transplant often occurs in the hospital. And these patients will use immunosuppressant drugs, medicines either they can take by mouth or by an IV that helps their body accept the donor cells. The other type of transplant is autologous, or auto for short. They use the patient's own cells, and recovery time is shorter and is calculated as 30 days from the day of discharge from the hospital. Caregiver guidelines are basically the same for each, but the length of time a caregiver is needed is different by the type of transplant. Your caregiver roles. For the allo patients, it is for the caregiver to be available for 100 days after transplant, or as told by the patient's doctor. We do suggest you have backup caregivers. The caregivers are to take the patient to and from appointments, and for the allo patients, it's about 2 or 3 clinic visits per week, and please do plan on spending the whole day at the City of Hope clinic for those visits. The caregiver is to help the patient with the things they need to do every day, help make their food, drive them to appointments, help take care of the home. The caregiver can help the patient take the right doses of medications at the right times. This is very, very important for their recovery. And also, the caregiver can help look for physical and mental and nutritional changes in the patient's overall health and report it to the team. Sometimes the physicians may advise you on how much time you can spend away from the patient. So please do check with the patient's doctor about the time you can be away from the patient. The caregiver's role for the auto patients is very much like the role for the allo patients. It is just for a shorter period of time. Caregivers should be available for the auto patients for 30 days after discharge from the hospital. The patient's physician may have a different timeline, but they will tell you about that. The caregiver should take the patient to and from the clinic follow-up appointments, and for the auto patients, this is about 1 clinic visit per week. The caregivers will still have the patients do the things they need to do every day. And important thing is also that they will help the patients take the medications, the right doses at the right time. And both for the allo and the auto, caregivers will help look for changes in the patient's overall health in a mini assessment. We will be going over how to do the mini assessment in a future slide. The table of contents, these are the topics we're going to cover today. The oncology nurse will go over the topics starting with be safe from germs and viruses at home, then be safe from germs and viruses around other people, how to care for the mind and body, GVHD. This stands for graft versus host disease and only is a condition that can happen to our allo transplant patients. Ways to stay healthy, food safety, medication management will be the last section covered by the nurse. The clinical social worker will start with the section Navigating Transplant with a Helping Hand, the day of discharge, communication, intimacy, and sexual activity, the practices of self-compassion and self-care, and caregiver resources. Be safe from germs and viruses at home. The next two topics will go over how to be safe from germs and viruses that may cause infection in the patient after discharge. Infections are often the number one cause of readmission to the hospital for our transplant patients. We do want you to know that even though everyone follows the guidelines, sometimes people may get an infection and need to come back to the hospital for help. Transplant patients have new immune systems and are not yet able to fight off common infections. Please be forgiving of yourself as a caregiver and practice self-care and self-compassion. Sometimes people get ill despite everything you do as a caregiver. These are guidelines for how to get your home ready before the patient is discharged and how to care for the home after the patient is home. It's really to have your home environment be clean and dust-free. This is because bacteria, viruses, mold, and other infectious or irritating agents can hitch a ride in dust and dirt. So do dust your blinds, drapes, and furniture. If carpeting is soiled and in need of cleaning, it's recommended that you shampoo the carpet before the patient comes home and let it dry thoroughly. That's because moist or damp carpets can be a home to mold and mildews. We don't want the patient to be exposed to mold and mildew in the home environment. Along those lines, please make sure that any air filters in your air conditioners or your heating units are clean and replaced according to the manufacturer's directions. If you did use a humidifier in the home before the patient was in the hospital, we do not recommend you use humidifiers when the patient returns home. This is because humidifiers can be a place where mold and mildew can grow and then get into the air the patient would breathe. It's important that the surfaces in the home be cleaned on a regular schedule. This means bathroom surfaces and the toilets and the surface in the kitchen and other areas where the patient frequently touches them. You can use cleaning products you buy and follow the manufacturer's directions to disinfect. You can also make an inexpensive bleach disinfecting solution, which can kill viruses and most germs. You put 4 tablespoons of bleach in a quart of water. You would spray it on the surface, let it set for the recommended time, then wipe it off. To make a larger amount, it's more concentrated. You would use 1/3 cup to a gallon of water. And for actual mold, you would use a cup of bleach to a gallon of water. The CDC website, www.cdc.gov, has very detailed information on how to clean surfaces and prepare the home to avoid transmission of germs and viruses from those surfaces. Do not remodel your home or do major fixes such as breaking down walls or pulling up old carpet at this time. This can cause mold and spores to go into the air, and we wouldn't want the patient to be exposed to those pollutants. And importantly, the patient should not be the one doing the cleaning at this time while they're recovering from the transplant. How to keep your home clean before and after the patient is home. Bedding. Wash the bed sheets at least once a week in warm or hot water. The patient should sleep in their own bed. If the patient is your partner, it's okay to share that bed. Patient's towels. The patient should have their own towels and have clean towels daily. On this slide is the website for the CDC on how to clean your home and disinfect surfaces. Again, the patient should not be the one doing the cleaning. Their energy should be going to their recovery, and the patient may want to leave the room when it's cleaned. How to get your car ready. The patient may spend a lot of time in the car, especially in going to and from clinic and follow-up visits. The car interior is another environment that needs to be cleaned and free of dust. So you want to take out any trash or clutter. You want to vacuum the surfaces and wipe them down. The surfaces don't need to be cleaned with any special agents. Just gentle soap and water will do. Make sure the air conditioning filters in the car are changed and up to date, and set the AC on circulate in order to filter the air that comes into the car. It's important to come back to the clinic as scheduled to monitor the patient's recovery. To do this, please check traffic, make sure the car is in good shape, and your gas tank is full. You may want to fill the gas tank without the patient being there because the fumes from the gas station can sometimes make patients nauseated. If there are more than 2 people in the car, we advise that everyone wear a mask, but especially the patient to wear a mask. Given we're in the middle of a COVID pandemic, please follow your community and City of Hope guidelines for wearing masks when out in the public. So plants are very important to many of us, but there are guidelines for how to have plants around patients and care for them. For aloe patients, you want to follow these guidelines for 100 days, or unless you're told differently by the patient's doctor. You want to remove fresh or dried flowers from the home. Remove houseplants from the main living spaces. It's okay to set them aside in a room away from the patient. This is because living plants or dried plants can have mold or dust and bacteria that can cause problems for the patient. The patient should not do any gardening post-transplant. You can ask your doctor when the patient could start gardening again. Please ask the doctor if you have any questions about having plants in the home. For our auto patients, these guidelines are for a different period of time, but you want to follow them for at least 30 days, or again, if the doctor may tell you different information. For auto patients, please follow these guidelines for 30 days, or unless told differently by the doctor. You also want to remove fresh or dried flowers from the home. Remove houseplants from the main living area. It's okay to set them aside in a room away from the patient. Some of our patients have found plant sitters for some plants. For auto patients, they recommend that they should not do any gardening post-transplant for at least 4 months. If you have any questions about how long they should not do gardening, please do talk to the doctor. How to care for pets. Pets are a very important part of our lives, and if the patient has a pet, we'd like them to get back to a normal routine with them as soon as possible, but with these guidelines. For the allo patients, again, it's 100 days from the transplant date. For auto patients, it's for 30 days from discharge. Do keep your pets as clean as possible. You may want to have the pets tested by a veterinarian to see if they have any health problems or any skin problems. It's very important to always wash your hands after you've touched your pet. Talk to your doctor about keeping your pet either indoors or outdoors, and if you have multiple pets. If your animals do go outside and come back in, keep your pet's paws clean. You may use a mixture of half vinegar and half water to soak and clean the paws, or you can use hypoallergenic baby wipes. Keep the claws short and smooth because rough claws could possibly tear the patient's skin or cause a scratch that could get infected. The do nots for pets: do not let the patient clean the cat litter box. If you have a cat and a cat litter box, do not keep the cat litter box in the patient's bathroom. Put it in another part of the house. Patients should not clean bird cages or fish tanks. Patients should not pick up dog waste, touch reptiles such as snakes or lizards because they can carry bacteria and organisms that can cause infections in our patients. And unfortunately, we do not advise the patient sleep with their pet if that has been their habit. But do talk to the doctor if you have any concerns about this. For the auto patients, it is the same guidelines. It is just for the 30 days from discharge. And any exceptions, please, or concerns, please do talk to their doctor. Be safe from germs and viruses around other people. This section covers how to help patients be safe from infections when they are around other people in social situations. How to keep safe from germs and viruses. Wearing a mask is one of the best ways to protect the patient as well as others from possible infection from viruses and germs from other people and in the air. The allotransplant patient should need to wear a mask from the 100 days from the day of transplant, and the autotransplant need to wear a mask when coming to the hospital for 30 days or as told by the doctor. Pediatrics, it's 30 days after the transplant. We're asking the patient to wear a mask when at the hospital and the clinic. The mask we recommend is called N95. You can buy them online. N95 refers to the size of the particle that can be filtered out by the mask. If you have trouble finding N95 masks for the patient, ask your medical team to help you get a supply. Caregivers may use surgical or fabric masks. Your doctor is going to talk to you about vaccines, or you may have questions. Again, for allo patients, there won't be any vaccines until about a year after transplant, but your doctor will advise you on the best schedule. Auto, again, the doctor will advise on the best schedule for vaccines. Before that, the patient should not get any vaccines and stay away from people who were given a Sabin oral vaccine or yellow fever vaccines for at least a month. We always recommend you talk to the doctor if anyone in your family would be around you and be given a vaccine of this type. Children in the family may need a vaccine, but talk to the medical team about how to avoid exposure to them at this time. Do not go near people who are vaccinated with a live virus through the nose. And always check with your doctor again before receiving any vaccines, or you may be near people who've received vaccines. One of the most important things we can do to keep ourselves and transplant patients safe from germs and viruses is to wash our hands well. This video will demonstrate good hand washing technique, and it also points out how often we unconsciously touch our nose, our mouth, or our face, and can inadvertently transmit viruses and germs to our mucous membranes, as well as to surfaces we touch. In addition to the mask wearing, hand washing is one of the most important things we can do to prevent transmission of germs and viruses. For good hand washing, we recommend lathering well and then using the lather to wash our hands for at least 20 to 30 seconds. Some people sing the happy birthday song twice or the ABC song to make sure they wash their hands long enough to remove all the germs and viruses.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands between your fingers and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Great. No more germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy. For more information, visit cdc.gov/hand washing.
Be safe from germs and viruses when we're around other people. It's really important as the patients recover to get back to the normal things they like to do. But they should stay away from crowded places such as sporting events or concerts, stadiums, movie theaters, crowded shopping places like Costco, or any other crowded area. If a spiritual practice is very important to them, like going to a temple or a church, please talk to the medical team about how the patient can do that safely. When they're there, they should not shake hands with other people or hug them or share food. When in public places, we recommend you follow the state and local guidelines to protect patients and caregivers from COVID infections. In place of getting together with people in crowds or small spaces, we recommend using social media or video chats. For fun, you may try a movie night or a game night, or even a Zoom get-together with family and friends. And walking in the neighborhood is always okay and can be enjoyable for caregiver and the patient. How to care for the mind and body. An important role of the caregiver is to do a mini assessment daily to monitor and support the patient's healing and recovery. This slide is a picture of a laminated checklist available to guide caregivers. It covers a mental, nutritional, and physical mini assessment. A laminated checklist is included in the Caregiver Toolkit. The Caregiver Toolkits are available in the social work office, the Biller Center, or by asking your social worker. Do the mini assessment twice a day, morning and night. It should only take about 5 minutes. We recommend having a notebook to keep track of the daily assessment findings and to record any concerns or questions you or the patient may have. If something has changed or is not normal, please write it down and call the Nursing Triage Call Center, 626-218-7133. For the mini-assessment mental part, again, you want to do this mini-assessment 2 times a day, morning and night. The mental assessment is done to see changes in the patient's mental health, and also these changes could indicate a physical problem like an infection. Everyone can have off days, but be alert for patterns and continued changes in mood that affect the patient's recovery, relationships, and ability to enjoy life. Questions you can ask: is the patient slow to answer? Questions like, can a stone float? What day is it? When's my birthday? If the patient is not making connections, in other words, they're foggy, they don't reason well, and they're not answering easily or following verbal cues. If the patient becomes more anxious, feeling really nervous and calm, really it's a point where they get to constant worry and it's interfering with their ability to rest. The patient can be depressed if they become more tearful, unable to enjoy the things that they usually do. Having many changes in mood or energy levels, please write those down. If the patient has disturbed sleep due to worry or anxiety, you would want to note that too. Please bring any concerns or changes in the patient's mental functioning to the attention of the medical team, or you can call the Nurse Triage Center at 626-218-7133. The nutritional assessment is done to keep the patient healthy and by getting enough food to have the energy they need to do the normal things and to heal. The transplant process can affect the patient's taste or sense of smell. They may not enjoy foods or eating as they did before the transplant. They could also have nausea or feel full easily. You will meet with the City of Hope dietitian before the patient is discharged. They will help with a diet at home. Use the notebook to write down any changes in appetite, changes in calorie consumption. Our goal is the patient eats about 1,500 calories a day. The nutritionist will help you monitor that. Do drink at least 8 cups of liquid a day. And for the patient, the liquid doesn't just have to be water. It can be diluted fruit juices, teas, soups, smoothies. It just needs to be in a liquid form. The physical mini-assessment. This is done to find early signs of fever, infection, and GVHD. GVHD, again, only applies to our allogenic transplant patients. Check body temperature. Use a digital thermometer on the forehead, ears, or mouth in the morning and at night. Do this before the patient bathes or eats. Call the nurse triage if the patient's temperature is at 100.4 Fahrenheit or higher. An elevated temperature can be a sign of infection. We recommend the patient bathe or shower every day. This is a good time to examine the skin. Look for any rashes, swelling, bumps, bruises, lesions, skin color changes from head to toe. The caregiver can help the patient check for problems in places the patient can't see. Look for redness, white patches, or lesions in the mouth. Use a soft toothbrush for cleaning and non-irritating mouthwash in oral care. Check the patient's urine output and bowel patterns. Patients should be urinating 6 to 8 times a day, and if they have trouble with constipation or diarrhea, please make a note of it and talk to the doctor and nurses about it so we can help. Check for disturbed sleep, because this can be due to changes in the body, or it even could be due to new pain or uncontrolled pain. Please let the medical team know because they can help with that. Record temperatures and physical concerns in your notebook. Let the medical team know of any problems because they can help you keep the patient healthy and comfortable. So in the physical assessment and monitoring the patient, stay alert for fever. A fever is a temperature of over 100.4 degrees Fahrenheit. As we said, it can be a sign of infection. We recommend taking the patient's temperature twice a day or whenever the patient just is not feeling well. Make sure you have working thermometers at home. We recommend you keep one in your car and maybe carry one in a purse. Digital thermometers can be used and are easy to read. If they do need batteries, keep extra batteries handy. These are tips to keep the skin strong and safe from infection for the patient. The patient should stay out of the sun as much as possible. They're very sensitive to the sun after the transplant process. Make sure the patient wears sunblock, at least SPF 30 daily, even in the car and on cloudy days. It's helpful to wear hats, have long sleeves, pants, and sunglasses to lessen the risk of skin rashes, burns, insect bites, and it can stimulate problems for graft versus host disease in our allo patients. Use an umbrella when out in the sun. Keep your showers short for the patient, less than 10 minutes, and use water that is warm or cool, not too hot. Use skin moisturizers after bathing as needed, but putting moisturizers on after showers is a good time to keep moisture in the skin. Use moisturizers that are hypoallergenic and unscented, such as Cetaphil, CeraVe, Aveeno, Vaseline, and other types of lotions. If you see any rashes, redness, or skin changes, do report it to the medical team. Now we're going to talk about graft versus host disease, GVHD. This is a condition that only applies to our allogeneic allotransplant patients. These are patients who have a matched donor, and their caregiver is asked to be with them for 100 days from the transplant. So what is graft versus host disease? For allotransplant patients only, an allotransplant uses blood-forming cells donated by someone else, their matched donor. The graft versus host disease, or GVHD, happens because the donated cells, the graft, and the patient cells, the host, are not the same. The new cells from the donor might attack the patient's cells because they see them as not the same. It's common and sometimes a serious side effect of an allotransplant. Graft versus host disease symptoms can range from mild to severe. So graft versus host disease can be either acute or chronic, and again, this applies only to the allotransplants. About half of all allo patients have some form of GVHD. If it's acute, it means it happens quickly, usually between day 7 to 100 from the transplant. Some patients will not have any acute graft versus host disease. If it's chronic, it occurs later. It's from day 80 on and can stay 3 to 6 months after the transplant. But signs can show up earlier as acute or even later. Patients are more likely to get chronic GVHD if you've had acute GVHD. You can check your transplant binder for further information, and there's really good information at the City of Hope website, www.cityofhope.org/GVHD. The daily mini assessment of the skin for our allo patients is a good time to check for signs of GVHD and record what you find. This is a table that helps you look and understand signs and symptoms of GVHD. The caregiver can use this as they do a mini assessment of the patient. For acute, and this would happen early in the patient's transplant process, the skin may show signs of redness on the palms of the hands or the soles of the feet. There could be a rash over other parts of the body, and the skin could become sensitive, itchy, or dry. You would want to record these findings in the notebook and let the team know right away. For the GI tract, the patient could have some diarrhea, more nausea, loss of appetite, or abdominal cramping. Again, make the note of those symptoms and report it to the doctor and the nurses. The liver could be affected as well. It can become enlarged. You won't be able to see that, but if it's enlarged, liver function tests, the blood work will show that, and the doctors will monitor it. You could have some abdominal tenderness. For chronic GVHD, the areas of the skin that had rashes or became sensitive or dry could become darkened and continue to be dry and peeling. The GI tract, the symptoms of diarrhea could lead to weight loss, and loss of appetite could lead to difficulty eating. And orally, patients can also experience dry mouth. Signs of chronic GVHD for the skin can include darkened and dry skin areas or areas of skin that are peeling and itchy. For the GI tract, it could mean continued diarrhea with weight loss and loss of appetite. Orally, the mouth could become very dry. For liver or other organs, there's a gradual increase in the liver function tests. Abdominal tenderness can continue, but this sometimes shows up as a yellowing of the eyes and of the skin. It can then, if it's chronic, can sometimes affect lungs, make it hard to take deep breaths, and have the patient might feel short of breath. And in the eyes, it can be dry eyes or extremely sensitivity to light. Use the daily mini assessment to record the GVHD symptoms and findings. Report them to the medical team because early intervention can help manage these symptoms and minimize them. It's important for the medical team to intervene early so they can address the drugs that manage the GVHD. So how could you lower the risk of GVHD and control the symptoms? The most important thing the caregiver can do is help the patient take their medications as prescribed by the doctor. These medications have names like sirolimus, tacrolimus, or cyclosporin. Keep taking your medications on schedule even if you feel healthy. Call the doctor right away if you can't take a medicine for any reason or you forget a dose. And even with all the medications, some people get GVHD. It's important to know that City of Hope is very experienced in managing GVHD and has a lot of work and approaches to minimize these problems. The caregiver can help watch for early signs of GVHD and tell the doctor. Do not brush off the early signs and think, oh well. Do tell the doctor. Early treatments, as we said, and for other side effects from treatment can make a big difference in the patient's long-term recovery. Again, it's important to remember to protect the patient's skin from the sun and keep the skin healthy. Even with medical treatment, some people may still get GVHD. Ways to stay healthy. This section is about being physically active. Body exercise. Activity helps the patient heal. Daily exercise is good for the patient and for the caregiver. For the patient, daily physical exercise will keep the heart strong. It's good for circulation. Daily physical exercise will keep the lungs going, promotes deep breathing. Physical exercise keeps muscles from getting weak. It helps build up strength and endurance. And if we are stronger physically, it lowers the chance of injury and can lessen the chance of falls. What kind of fitness goals should the patient have? Caregivers can help the patient reach their fitness goals. To begin with, the patient's rehab team and physical and occupational therapists at City of Hope will give the patient a home exercise program to follow. Daily walking is a good way to build up endurance and become stronger. If the patient is too tired to do any exercise and they don't want to get out of bed, at least have them sit up in a chair for a few hours a day. Outpatient physical therapy or occupational therapy may be needed if the patient is not strong enough or finds it too hard to do daily activities at home. Talk to the doctors about getting a referral or having physical therapy visit you at home. If you have any questions, the rehab team would be happy to help you. You can call them at 626-218-3328. So it's also important to do mental activities to keep the mind sharp. As the patient gets back to normal activity, it's also helpful for mind to do exercises. Caregivers may enjoy them too. Doing mental exercise daily is important. Try math or logic puzzles, memory and concentration games, problem-solving games, or crossword puzzles. A good activity is to try filling the words in backwards. For caregiver and patient well-being and wellness, we recommend asking questions as frequently as the caregiver feels necessary and the patient. Do write down the questions and information provided. As the patient goes through recovery, be flexible with the potential ups and downs of the whole transplant recovery process. Try to focus on what you can do, not what you cannot do. Some days may be better than others. Do the best you can on each day to make it count, and take one day at a time. Learn about our supportive care services at City of Hope. Our social worker can help. You can call the Department of Clinical Social Work at 626-218-2282. You can check out more information on our classes, support groups, or other programs at the Sherry and Les Biller Patient and Family Resource Center. The location is in the main medical building. To help the patient have a healthy recovery, the transplant patient should follow food safety guidelines. After transplant, it is easier for the patient to get sick from bacteria, viruses, or parasites that can sometimes be in foods. This means that the patient cannot eat takeout food from a restaurant because there is no way to know how the food was prepared, cooked, or who touched it. Follow the 4 basic steps for food safety. You want to clean the food, separate different foods, cook the food, and then chill it or store it in the proper way. You can always follow the doctor's advice if it differs, or if you have questions about specific foods, ask the doctor. The guidelines are on www.befoodsafe.org. This slide summarizes food safety. So to clean, we want you to wash your hands, your utensils you're using, and cutting boards before and after you touch or prepare raw foods. You want to separate foods. You want to keep raw meats and poultry apart from foods that won't be cooked. That means keeping meat juices away from fruits and vegetables. To cook, you want to use a food thermometer and check that foods are cooked to the proper temperature. The chart is below. Chill, it has to do with storing cooked foods and leftovers. So you want to chill leftovers and take out foods within 2 hours and keep the fridge at 40 degrees or below. If you have any questions about this, call the Clinical Nutrition Services at 626-218-2108. This is a guide to foods that are safe for our transplant patients to eat and foods that they should avoid. Basically, patients should stay away from raw, undercooked, or unpasteurized foods. So the type of food for meats, deli, and poultry products, foods that are safe to eat, they have to be cooked to an internal, safe minimum temperatures. Hot dogs and lunch meats and deli meats need to be reheated again to at least 165 degrees Fahrenheit. In this category, foods to avoid raw, undercooked meats or poultry. Avoid deli meats or hot dogs that have not been reheated. In fish and seafood, previously cooked seafood needs to be heated to 165 internal temperature. You can eat canned food and seafood and any fish cooked to the safe minimum internal temperatures. But the patient should avoid raw or undercooked foods, seafoods. No sushi, unfortunately, no ceviche, no refrigerated smoked fish, and no partially cooked foods. So all fish needs to be thoroughly cooked to the right internal temperature. For milk, only pasteurized milk and milk products. A patient should not use unpasteurized raw milk. Cheeses that are clearly labeled made from pasteurized milk are acceptable. So that's hard cheeses, processed cheeses, cream cheese, mozzarellas, and some soft cheeses. They just need to be made from pasteurized products. But any soft cheeses made from unpasteurized or raw milk should not be given to the patient. This could be feta, brie, camembert, or queso fresco, Mexican cheese type. Other foods to think about are eggs. For eggs, we recommend use pasteurized eggs or egg products when preparing recipes that call for raw or undercooked eggs. Foods to avoid in this category are anything that would have a raw egg. Homemade Caesar salad dressing, homemade raw cookie dough, homemade eggnog, homemade mayonnaise. Nuts, only roasted cooked nuts, no raw nuts. Fruits and vegetables. For fruits and vegetables, it's important to wash them thoroughly under running water. Cooked sprouts you can have, but no raw sprouts. Cooked, frozen, or canned fruits and vegetables are fine. Canned or pasteurized fruit and vegetables also. But you do want to avoid raw vegetables like raw sprouts, unwashed fruits and vegetables, fruits that have any visible mold or soft spots, and any unpasteurized fruit or vegetable juices. Pâtés, you may have canned pâtés, but you want to stay away from unpasteurized pâtés or meat spreads. Honey, be aware that the honey a patient would be using would be pasteurized and cooked, and you only want to use baked goods that have pasteurized cooked honey. Avoid any unpasteurized or raw honey. So to go over the food safety guidelines preparation, again, first is clean. Clean your hands and work surfaces often. Wash hands in warm, soapy water at least 20 seconds. It's the time it takes to sing the happy birthday song twice. Be sure to wash off the rubber or plastic cutting boards in the dishwasher with hot soapy water between preparing foods, and use different cutting boards for meat, seafood, and produce. This avoids the possibility of meat juices contaminating vegetables or fruits. Wash dishes, pots, and can openers and utensils in very hot soapy water and rinse with running hot water. Let them air dry. Do not use a dish towel to dry them. The dish towel can transfer any contaminants from one pan to another. Be sure to clean your countertops and cutting boards between working with raw meat, poultry, or other seafood and foods that will not be cooked. Clean countertops and cutting boards in between working with raw meat, poultry or seafood, and foods that will not be cooked. You may use a weak bleach solution of 1 tablespoon of bleach to a gallon of water for cutting boards. The bleach or disinfecting wipes can also be used for countertops, but follow the manufacturer's directions. Wash all fruits and vegetables under running water. You don't need special cleaning rinses to wash fruits and vegetables. For food safety, you want to be sure to separate the foods. This is because bacteria can spread from one food to the other. Again, handle the raw meats, poultry, and seafood and eggs with care and separately. Keep raw meat and their juices away from ready-to-eat foods, and be sure to wrap and store all raw meat, poultry, and seafood securely to keep juices from getting in other foods. Now you're ready to cook. You need another type of thermometer at home, a food thermometer. Check your foods for the patient to a safe internal temperature. That's inside the core of the food. For temperature, see the food guide table slides or the food safety summary table. When cooking in a microwave, cover food, stir, and rotate for even cooking by hand or in a microwave turntable. A gas barbecue grill can be used, but clean it very well before use, and do not use charcoal briquettes or public grills. So food safety step number 4 is to chill foods. This is really about how to store foods properly. Cold temperatures slow the growth of harmful bacteria. Store your refrigerator foods at 40 degrees Fahrenheit or below. Store frozen foods at 0 degrees Fahrenheit. You might use an appliance thermometer to check temperatures of your freezer and refrigerator. The guidelines are to cook or freeze fresh poultry, fish, or ground meats within 2 days, other meats within 3 to 5 days after you buy them. But do chill all leftovers in the fridge within 2 hours, and if it's very hot, within 1 hour, and use within 2 days. Do not eat leftover foods or do not serve them to the patient if they have been in the refrigerator for more than 2 days. Medication management. It's important for the caregiver to help the patient take medications as prescribed. The caregiver can also observe for any reaction to medications and let the medical team know if there is a problem. How to take the medications at home. We recommend that the caregiver know the reason for the medications and what the medication does. To help, make a medication calendar or diary. You can use the notebook for the mini assessments to also write down the medications. Write down the names, doses, and schedules of medications and record when medications are taken or if a dose is missed. Use a medication pill box. Have a pill box with 4 doses per day. Do not fill the pill box with more than 4 days of the medication at any time. This is because the doctor may change the medications or the dose of the medications depending upon how the patient is doing from clinic visit to clinic visit. Medication management apps can also be used. Store medications the right way and in a safe place. If you have questions about storing medications, ask a pharmacist. For allo patients on clinic days, usually they're advised to hold their immunosuppressant drugs until after the lab testing. Please confirm this with the medical team. Caregivers and patients, let your medical team know if there is a bad reaction, for example, a rash, a sudden fever, headache, or nausea. You can check the information that came with the medication, but you can also call the nurse triage line. If a dose is missed, the doctor will advise you on when to take the missed dose. Let the doctor and team know if any nutritional supplements, vitamins, herbal medicines, or cannabis are used. This is very important as some supplements can interfere with the effectiveness of prescribed medications. Cannabis that is smoked can cause lung infections or other lung issues. Let the team know if there is any trouble getting the medicine that you were prescribed. The medical team can help you get the medicine that the patient needs. This is a slide of handy City of Hope contacts. It is our general number, and you dial 0 or ask for the doctor's office. A note I'd also say is please talk to the patient's doctor about how they like to be communicated with. What is the best way to reach them during clinic hours, and what is the best way to reach them after hours? You can also reach City of Hope on weekends. There is a City of Hope prescription refill line. And the most important number on here, though, for any questions or concern is our City of Hope 24-hour nursing line. That's 626-471-7133. So as I said, the nursing triage line is very important to helping you care for your patient and to communicate with the medical team. The nurse triage line is 626-218-7133. When should you call the nurse triage line? Don't delay if there is any problem, question, or concern that you or the patient have. The nurse triage line is there to help you and the patient. Watch for important symptoms to report when the medicines do not help. It could be the patient is throwing up, vomiting, having more diarrhea. If there's any bleeding that does not stop, any rashes that are new or you don't know what to do with, if the patient cannot eat or drink fluids, that's very important, or especially if they have any uncontrolled pain. Watch for signs of infection. Please call the nurse triage line if the patient has a temperature of 100.4 degrees or higher. If they're shaking and chills when you flush the catheter, chills without a fever. Chills, fever, and patients that just can't get warm is sometimes a sign of infection. Call if there's a cough, a lasting cough with or without phlegm, and a cough, sneezing, or throat pain or swelling that seems unusual. Just let the medical team know so they can help. Another important thing to think about is when you might want to call 911. So 911 is for true emergencies. Call 911 right away if the patient has any of these symptoms. Very strong chest pain, trouble breathing, bleeding again that does not stop, unconsciousness, a serious injury or a burn. If the patient falls and could break a hip, that is a 911 call. Signs of shock. This would mean there would be a rapid pulse. The patient's skin would be pale and clammy. They would be very confused and have rapid breathing. This could be a sign of infection, but it's important that they get medical attention right away. If the patient has mental changes, again, where they're very slow to answer, it could be a sign of a stroke. So they have trouble speaking, severe headaches, numb feeling in the face or legs. If it seems really serious or unusual, call 911. If the patient is taken to another hospital because of emergency, the caregiver can provide the patient's medical information and tell the EMTs that the patient is a transplant patient at City of Hope. The caregiver can then also let the City of Hope patient's doctor know where the patient is receiving care. This is the end of the oncology nurse topics presented for the class for our caregivers planning for the HCT patient to go home. Thank you for your attention. We sincerely hope this class is helpful to you in your important caregiver role. The next topic, Navigating Transplant with a Helping Hand, is presented by our City of Hope clinical social worker.
Hello, everyone. I am a clinical social worker here at City of Hope. I am on the hematology service line and often work with patients and families as they navigate the transplant experience. While the first portion of this class primarily focuses on how to help the patient, my portion will focus on how to help you as the caregiver. Your role is incredibly important, and we want to give you the tools and resources to not only care for your loved one, but also to care for yourself. I first want to introduce you to clinical social work and our role on the care team. As a clinical social worker, I work closely with the medical team on the inpatient and outpatient side. At City of Hope, we recognize that cancer affects the whole person and family in emotional, social, and practical ways. It is common for patients and their families to experience distress, and this can show up in a lot of different ways, including worry, anxiety, depression, fear, and uncertainty. Clinical social workers can help you and your family identify and reduce sources of distress and develop effective coping skills to manage challenges that arise during the cancer trajectory. We offer supportive counseling for adjustment to illness and ongoing treatment. We also have a couples program which is designed to support patients and their partners navigate the cancer experience. Finally, clinical social work can assist with advanced directive conversations and completion, end-of-life and hospice discussions, and grief and bereavement support. Clinical social work can assist with identifying a host of resources in your community, including counseling and mental health services, financial aid, transportation, wellness classes, and support groups. Along similar lines, clinical social work can provide education on benefits, including disability and family medical leave. We can also connect you with interpreter services. To reach your clinical social worker, call the Division of Clinical Social Work at 626-218-2282. We are located at the Duarte campus in the main medical building, down the hall from the pharmacy. You may feel a host of emotions on the day of discharge. We are here to help. The next few slides will let you know what to expect as you prepare to leave the hospital after transplant. Getting ready to discharge can be an emotional experience. When you leave the hospital, your medication regimen may be adjusted. A member on your care team will review the new list of medications with you before you go home. You will have frequent clinic appointments, meeting with your primary physician 1 to 2 times a week following transplant. It is important to remember that recovery takes time. You might notice some changes in your mood as you adjust to your new routine and environment. Your energy levels may fluctuate from day to day. You may also notice a difference in your appetite. These changes are normal and in most circumstances temporary. On the day of discharge, we ask for caregivers to be here by noon to go over discharge tasks with the medical team. Patients will be meeting with the nurse, case manager, pharmacist, and other medical staff as needed. While we do our very best to set up a smooth discharge, there may be changes in the plan. Our goal is to discharge you home safely and ensure both you and your loved one feel secure in the plan. It is also important to note that readmissions do occur, and we are here to support you. Communication with your care team and with your loved ones is vital during this time. In the next few slides, we will discuss communication and changing relationships. It can be overwhelming to think about leaving the hospital, and you may have questions when you arrive home. It is important to communicate with your healthcare team. Keep a notebook with a running list of questions and concerns. When you attend your clinic appointments, you can raise these questions with your physician. Ask questions about things that are unclear. It is okay to ask for clarification. Ask your healthcare team about the best way to communicate with them between appointments. Some physicians prefer emails, while others prefer telephone calls. Find out what works for them. Equally important is communicating with your friends and family. In some cases, it can be helpful to identify a family spokesperson to provide updates about how you and the patient are doing. Others have found Caring Bridge beneficial. This platform allows patients and their loved ones to create a website where you can post medical updates and send messages to family members and friends. Along similar lines, social media can be a useful tool for maintaining communication. Many people may want to help but aren't sure where to start. Think about things you could use help with, whether it's household chores, cooking, cleaning, shopping, or transportation. Lots of helping hands is a central place to coordinate meals and help for friends and family. Relationships can change when a person goes through a major medical event. You may notice a shift in your relationship with patient or with other friends and family members. Some relationships will falter, and this is not your fault. People in your life may not know how to help. They may not know the right words to say or how best to support you. It is important to think about what you need the most, and sometimes that means being left alone. Not all help is helpful. It's okay to let people know if what they are doing does not meet one of your needs. In the next few slides, we will talk about intimacy and sexual activity. You may have questions about this, and that's okay. Intimacy is the closeness two people share and can be found in all types of relationships. This may change for some time following transplant. Remember, it is okay to touch or be close to your loved one post-transplant. Often people ask whether they can continue to share the same bed, and the answer is yes. We encourage this. Find a date night that fits both of your needs, whether that's a game or movie night or a home-cooked meal on the couch. The time after transplant allows you to modify the activities you already love. When you are ready to resume sexual activity, it is important to have an open dialogue with your physician. Check in with your medical team. The type of sexual activity and levels of platelet and white blood cell counts will help the physician let you know what is safe for the patient. The transfer of toxins can happen up to 48 to 72 hours after treatment. Talk to your physician about whether this is something to be concerned about. Patients and their partners should continue to use safe sex practices. It is also important to note that there may be changes in sexual desire after transplant. This is temporary. Communicate with your medical team when you are ready. Talk about any questions or concerns you may have. If the patient is experiencing pain during sex, make sure to tell your physician. Men may have brown or dark orange semen due to chemotherapy or radiation therapy. This will go away, but you can ask your physician how long it may last. Women may have vaginal dryness, and a water-soluble lubricating jelly can be used in these circumstances. If you notice any unusual problems, bring these concerns to your healthcare team. There are resources available to help you and your partner. The Positive Image Center here at City of Hope has products that can help with sex and intimacy. The American Cancer Society has also created some helpful literature. Sexuality for the Man with Cancer and Sexuality for the Woman with Cancer can be found in the Biller Patient and Family Resource Center. Cancer treatment can affect body image, self-esteem, and sexuality. Our Self-Esteem, Appearance, and Sexuality series provides a safe space for patients and their partners to explore concerns related to treatment and the extent to which this impacts your physical, social, emotional, and sexual self. If you are interested in participating, you can request a referral to occupational therapy. In order to take care of the patient, it is important to take care of yourself. Remember that you are doing the best you can. Practice self-compassion, especially on days that may be harder than others. The caregiver's role is vital. You may feel happy, excited, angry, sad, all in the course of a week, day, or even an hour. This is to be expected. Remember to be kind to yourself and ask for help if and when you need it. What are some things you do for self-care? What helps you to reset and recharge? Are there activities that ground you? Are there things that bring you joy, comfort? Take some time to think about this as we move forward. Self-care is essential. Here are 10 ways to recharge. Take time to breathe. Really breathe. Deep breathing and mindfulness meditation exercises are a great way to reset. Take a shower or a bath, take a walk and change your space, listen to music or watch a funny video. Cuddle your loved ones or your pets. There are so many ways to recharge, and it's important to find what works for you. There are a lot of meditation apps out there, many of them free to access. Even a 3-minute meditation can make a difference. Take a moment to research some of these apps and see if one of them suits your needs. City of Hope offers several education and support groups, and many are available to both patients and caregivers. Some groups are disease-specific, while others cater to a certain population. Our Caregivers Connect group is a wonderful resource for caregivers to meet others going through similar experiences. There are also a host of community-based agencies which offer peer mentorship and support. Be the Match, Bone Marrow Foundation, Leukemia and Lymphoma Society, and Immerman Angels are among the agencies offering this type of support. Talk to your clinical social worker about the groups offered in your area. In addition to support groups, City of Hope also offers various informational classes. For the most up-to-date information regarding groups and classes, visit the Biller Resource Center at City of Hope or call 626-218-2273. Your clinical social worker can help you identify additional caregiver resources, depending on your need. The next slide details additional resources available to caregivers. The National Family Caregivers Association provides information and support to individuals caring for someone who is chronically ill. The California Department of Aging has support services for older adults and those with disabilities. The Employment Development Department provides information regarding state disability and paid family leave benefits. Your clinical social worker can help you navigate this process. There are caregiver toolkits available in the Clinical Social Work Office for pickup. If you're interested in obtaining a toolkit, feel free to reach out to your clinical social worker. There's some useful resources in the toolkit, including a caregiver guide, caregiver shopping list, and a laminated mini assessment page. I encourage you to do this meditation exercise in your own time. It's just 3 minutes long and can make a huge difference in your day. Thank you for following along. This concludes our class. I hope this presentation has been helpful for you. We know how important your role is. We value and appreciate you and all that you're doing. If you find yourself with additional questions or are interested in attending the virtual class, please don't hesitate to reach out to the Clinical Social Work Office for further support.